ColoClear is a non-invasive stool-based FIT DNA test for colorectal cancer screening with an accuracy of 96% sensitivity, an NMPA-approved advanced DNA-based technology that detects both cancer and precancerous polyps. For this test, you'll need to take a stool sample using the kit. But before you do so, there are a few things to consider. In order to avoid contaminating your sample and negatively affecting the results of your test, please do not take the test if you're knowingly experiencing any of the following: menstrual bleeding, rectal bleeding, diarrhea, and/or watery stool. With that out of the way, let's begin. First step is to get everything ready. Oh, and one more thing. Before we carry on with the next part, make sure you empty your bladder. This is to avoid contaminating the stool sample with urine. Next, we need to set up the sample collection pad. Lift the toilet seat, unfold the collection pad, and peel off the yellow paper from each end of the collection pad. Next, place the sample collection pad on top of the toilet bowl with the adhesive facing the edges of the toilet bowl and secure the collection pad by lowering the toilet seat. Once the collection pad has been set up, prepare yourself to have a bowel movement in the center of the sample collection pad. Avoid contaminating the stool with any urine, toilet water, and/or tissue paper. Step 2. Collect your sample. Use the sampling scoop to collect a stool sample the size of approximately the first part of your thumb. Place your sample with the scoop inside tube A. The sample together with the scoop should not exceed the double line of 25 ml. If your sample exceeds the double line, you can reduce your previous sample using the scoop or resample by using your scoop and discarding your previous sample. Do not pour out the preservation liquid from tube A. Ensure you close the cap of the tube properly. Flip the tube 3 times to ensure the stool is properly submerged in the preservative liquid. Insert the serrated tip in the stool at 5 different points, which will ensure enough and only the correct amount of sample is collected. Return the probe into tube B and ensure the cap is closed properly. Step 3. Pack your sample. Place tube A and B in the 2 provided specimen bags and put the samples in the white blister and then in the padded envelope. Ensure you have closed the specimen bags properly and store your sample in a cool, dry place away from sunlight at room temperature or in the refrigerator. The temperature must be between 2 to 30 degrees Celsius. Next, you can remove the flushable center of the collection pad by peeling off the corners and flushing it together with the remaining stool. The cardboard and gloves can be disposed with the normal rubbish. After disposing the cardboard and gloves, wash your hands. And lastly, step 4. You can return the sample to our lab directly or book a complimentary courier service up to 3 days in advance. To do that, scan the QR code for the return instructions. Your doctor will get in touch with you to share your results in just a few days. A simple, easy, and effective at-home procedure that delivers results in days and keeps you up to date with your health and provides a peace of mind.